Hello everyone, welcome to our channel where we discuss various health-related topics to help you live a healthier and happier life. Today's topic is all about lowering blood pressure naturally. High blood pressure, or hypertension, is a serious health condition that affects a large percentage of the global population. It is often called the silent killer because it doesn't typically cause noticeable symptoms, but can lead to serious health problems like heart attack, stroke, and kidney disease if left untreated. According to the World Health Organization, high blood pressure is a leading cause of death and disability worldwide. While medication can be an effective way to manage high blood pressure, lifestyle changes can also make a significant difference. Making simple changes to your diet, exercise routine, and stress management techniques can all help to lower your blood pressure naturally and improve your overall health. In this video, we'll be sharing 10 tips on how to lower your blood pressure naturally and take control of your health. Whether you're looking to prevent hypertension or manage an existing condition, these tips can help you live a healthier, happier life. So let's dive in. 1. Watch your sodium intake. Sodium is a mineral that is essential for the body, but consuming too much of it can cause water retention and increase blood pressure. The recommended daily intake of sodium is less than 2,300 mg, mg, per day, which is about 1 teaspoon of salt. However, most people consume far more than this. To reduce your sodium intake, avoid adding salt to your meals and limit your intake of processed and packaged foods, such as canned soups, frozen dinners, and snack foods. Opt for fresh fruits and vegetables, lean meats, and whole grains instead. One easy way to reduce your sodium intake is to cook your own meals at home using fresh ingredients. This allows you to control the amount of salt that goes into your food and also ensures that you're getting all the nutrients your body needs. If you do use salt when cooking, try using less than the recipe calls for and gradually reduce the amount over time. You may be surprised to find that your taste buds adjust and you no longer need as much salt to enjoy your food. 2. Maintain a healthy weight. Maintaining a healthy weight is important for overall health, but it can also have a significant impact on your blood pressure. Being overweight or obese can increase your risk of developing high blood pressure, and losing even a small amount of weight can help to lower it. One way to determine if you are at a healthy weight is to calculate your body mass index, BMI. A BMI between 18.5 and 24.9 is considered healthy, while a BMI of 25 or higher is considered overweight. If your BMI is in the overweight range, losing just 5 to 10% of your body weight can help to lower your blood pressure and reduce your risk of other health problems. To achieve a healthy weight, focus on making sustainable lifestyle changes rather than following fad diets or extreme weight loss plans. Eating a balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins can help you lose weight and keep it off. In addition, regular exercise can help you burn calories and maintain muscle mass, which can help keep your metabolism strong. To achieve a healthy weight, focus on making sustainable lifestyle changes rather than following fad diets or extreme weight loss plans. Eating a balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins can help you lose weight and keep it off. In addition, regular exercise can help you burn calories and maintain muscle mass, which can help keep your metabolism strong. If you're not sure where to start, consider speaking with a registered dietitian or certified personal trainer. They can help you create a personalized plan that takes into account your unique health needs and goals. Remember, small changes can add up to big results over time, so don't get discouraged if you don't see immediate results. By making healthy choices every day, you can achieve a healthy weight and improve your overall health. 3. Exercise regularly. Regular physical activity is another important factor in maintaining healthy blood pressure levels. Exercise helps to strengthen the heart and circulatory system, which can help to lower blood pressure over time. It also helps to improve overall cardiovascular health, reduce stress, and promote healthy weight management. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic exercise per week, or 75 minutes of vigorous intensity aerobic exercise per week. This can include activities such as brisk walking, cycling, swimming, or running. Strength training exercises, such as weightlifting or using resistance bands, should also be incorporated into your exercise routine at least 2 days per week. If you're new to exercise or have existing health conditions, it's important to speak with your healthcare provider before starting a new exercise routine. They can help you determine the best types of exercise for your needs and help you create a safe and effective plan. Remember that exercise doesn't have to be complicated or time-consuming to be effective. Even small amounts of physical activity throughout the day, such as taking the stairs instead of the elevator or going for a short walk during your lunch break, can add up and help to improve your overall health. In addition to structured exercise, finding ways to incorporate physical activity into your daily routine can also be beneficial. This can include gardening, dancing, or playing sports with friends and family. The key is to find activities that you enjoy and that you can sustain over time, so that exercise becomes a regular part of your life. 4. Limit alcohol consumption. While moderate alcohol consumption, up to 1 drink per day for women and up to 2 drinks per day for men, has been linked to potential health benefits, excessive alcohol intake can have a negative impact on blood pressure. Alcohol can raise blood pressure by stimulating the sympathetic nervous system, which controls the body's fight or flight response. This can cause the heart to beat faster and blood vessels to constrict, leading to higher blood pressure. To help lower blood pressure and reduce the risk of other health problems, it's important to limit alcohol consumption. If you choose to drink, do so in moderation and be aware of the standard drink sizes. 1 standard drink is equivalent to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. If you have difficulty limiting your alcohol intake, consider seeking support from a healthcare professional or joining a support group. They can provide guidance and support to help you reduce or quit drinking. In addition, it's important to note that alcohol can interact with certain medications, including blood pressure medications, and make them less effective. If you take medication for high blood pressure, talk to your healthcare provider about how alcohol may affect your treatment plan. 5. Quit smoking. Smoking is a major risk factor for high blood pressure and other cardiovascular diseases. The chemicals in cigarette smoke can damage the lining of the arteries, making them more prone to plaque buildup and narrowing. This can lead to hypertension and increase the risk of heart attack, stroke, and other health problems. If you smoke, quitting is one of the best things you can do for your overall health and blood pressure. Within just a few weeks of quitting smoking, blood pressure can start to decrease, and over time, the risk of cardiovascular disease and other health problems can also decrease. There are many resources available to help you quit smoking, including nicotine replacement therapy, prescription medications, and support groups. Talk to your healthcare provider about which options may be right for you. It's also important to note that exposure to secondhand smoke can also increase blood pressure and cardiovascular risk, so if you live with someone who smokes, encourage them to quit or take steps to minimize your exposure to smoke. 6. Manage stress. Chronic stress can have a negative impact on blood pressure and overall cardiovascular health. When you're under stress, your body releases hormones that can cause your heart to beat faster and your blood vessels to constrict, leading to higher blood pressure. To help manage stress and lower blood pressure, it's important to incorporate stress-reducing activities into your daily routine. This can include exercise, meditation, deep breathing, yoga, or spending time in nature. It's also important to identify and address the sources of stress in your life. This may involve making lifestyle changes, such as reducing your workload or improving your time management skills. It may also involve seeking support from a therapist or counselor to help you learn coping strategies and develop a more positive mindset. 7. Monitor your blood pressure. Monitoring your blood pressure on a regular basis is an important part of maintaining healthy levels and preventing complications from high blood pressure. You can monitor your blood pressure at home using a home blood pressure monitor, which can be purchased at most drugstores or online. It's important to follow the instructions on the blood pressure monitor carefully, and to take your readings at the same time each day to ensure consistency. Your healthcare provider can help you determine the appropriate frequency and timing for monitoring your blood pressure based on your individual health needs. If your blood pressure is consistently high, your healthcare provider may recommend lifestyle changes or medication to help lower it. It's important to follow your provider's recommendations and to stay in communication about any changes or concerns regarding your blood pressure. In addition to monitoring your blood pressure, it's important to attend regular checkups with your healthcare provider to assess your overall cardiovascular health and monitor for any potential complications or health concerns. 8. Follow a healthy diet. A healthy diet is an essential component of maintaining healthy blood pressure levels. Consuming a diet that is high in fruits, vegetables, whole grains, lean proteins, and healthy fats can help reduce your risk of high blood pressure and cardiovascular disease. The dietary approaches to stop hypertension. Diet is a well-known dietary pattern that has been shown to lower blood pressure in numerous studies. This diet emphasizes consuming fruits, vegetables, whole grains, low-fat dairy products, lean meats, poultry, fish, and nuts and seeds, while limiting consumption of sodium, sweets, sugary beverages, and red meats. In addition to following the DASH diet, there are other dietary modifications that can help lower blood pressure, such as reducing your sodium intake. The American Heart Association recommends consuming less than 2,300 mg of sodium per day, and even less if you have high blood pressure or other cardiovascular risk factors. Other dietary modifications that can help lower blood pressure include reducing your intake of processed and packaged foods, which can be high in sodium and unhealthy fats, and consuming more potassium-rich foods, such as bananas, spinach, and sweet potatoes. Remember, making small changes to your diet over time can lead to big improvements in your overall health and blood pressure levels. It's important to work with your healthcare provider or a registered dietitian to develop a personalized dietary plan that meets your individual health needs and goals. 9. Increase your potassium intake. Potassium is a mineral that helps to balance the sodium in your body and relaxes blood vessel walls, which can lower blood pressure. The recommended daily intake of potassium is 4,700 mg. But most people don't consume enough of this mineral. Incorporating potassium-rich foods into your diet can help you increase your intake. Some of the best sources of potassium include bananas, avocados, sweet potatoes, spinach, tomatoes, white beans, yogurt, salmon, mushrooms. It's important to note that if you have kidney disease or are taking medications for high blood pressure, you should talk to your doctor before increasing your potassium intake. In some cases, too much potassium can be harmful. In addition to increasing your potassium intake, it's also important to maintain a healthy balance of other nutrients in your diet, such as calcium and magnesium. These minerals can also help to lower blood pressure and support overall cardiovascular health. Good sources of calcium include dairy products, leafy green vegetables, and fortified foods like tofu and orange juice. Magnesium-rich foods include nuts and seeds, whole grains, and leafy green vegetables. 10. Getting enough sleep is essential for maintaining healthy blood pressure levels. When you don't get enough sleep, your body produces stress hormones that can lead to increased blood pressure. Studies have shown that getting 7 to 8 hours of sleep per night can help to regulate blood pressure and reduce the risk of hypertension. It's also important to stick to a regular sleep schedule, as irregular sleep patterns can disrupt your body's natural rhythms and lead to imbalances in hormones that can affect blood pressure. If you struggle with getting enough sleep, there are a few things you can try to improve your sleep habits. Establishing a relaxing bedtime routine can help signal to your body that it's time to sleep. This could include things like taking a warm bath, reading a book, or practicing relaxation techniques like meditation or deep breathing exercises. You can also make changes to your environment to promote better sleep. Make sure your bedroom is dark, quiet, and cool, and invest in a comfortable mattress and pillows that support healthy sleep posture. If you continue to have trouble sleeping, talk to your doctor about possible solutions. They may recommend cognitive behavioral therapy or medications to help improve your sleep quality and regulate your blood pressure. In conclusion, high blood pressure is a serious condition that can increase your risk of heart disease, stroke, and other health problems. However, there are many lifestyle changes you can make to help lower your blood pressure and protect your overall health. By following the tips we've discussed, such as reducing your sodium intake, increasing your physical activity, and managing your stress levels, you can take control of your blood pressure and improve your overall well-being. Remember, it's important to work closely with your doctor to monitor your blood pressure and make any necessary adjustments to your treatment plan. With the right approach and support, you can successfully manage your blood pressure and reduce your risk of long-term health complications. Thank you for watching, and we hope these tips have been helpful for you. Be sure to like and subscribe to our channel for more health and wellness content, and don't forget to share this video with anyone you know who could benefit from these tips.